Hey guys, it's Martin Shkreli with part 2 of the Axovant Clinical Trials Analysis series. So I think where we left off is we're looking at press releases and SEC filings, so we might as well continue to do that. And what we'll also do is get to a PubMed search of the drug as well. So let's quickly kind of type in the stock ticker and the SEC filings, and I think, it makes sense to read every single one of these. It doesn't look like there are too many. I don't know, 40 here. Let's put up to 100. You go back 100, you pretty much are back to the start of the company. So you can see the S1 and so forth. So you're basically brand new at that point. So from 1 to 100 here. Draft registration statement, confidential registration statement, and so forth. And eventually the company goes public around 2015. Let's see, it's the S1 when effective, right? 610. So jot that here somewhere. 610, 2015. Company goes public. And actually, while we're here, let me just go jump on and make sure that the folks who want to see this live can see it live. Reminds me of Bill O'Reilly. We'll do it live. We'll do it live. This will just take a second. So hopefully that'll work out. Registration of securities. So what is this Form 8A? Not very common. Pursuant to Section 12 or Section 12B or 12G. So let's see. Trying to register. Oh, I see. This is a form for moving from NASDAQ or NYSE to NASDAQ. That's pretty interesting. So you'll never see that form again. We knew that form would be the case. Form 25 is the same type of form, right? We are no longer on New York Stock Exchange, so that's Form 25, and Form 8A is to move the securities to the NASDAQ. So those are pretty basic, right? So let's look at this 8K. There's the equity incentive plan. We should probably read that, actually. Well, let's see. So there's 20 million options now. That's quite a bit. All right. I don't spend too much time on stuff like that. Compensation plan. So they're moving to NASDAQ. We need that. Got a lot of filings related to that. And I wanted to just get the 10Q down real quick. So it's funny because sometimes they say they're in Basel, sometimes they say they're in Bermuda, and sometimes they say they're in London. So it's a little tough to figure out. Let's write that down. London, Bermuda, which is it? New York. All right, so we have the balance sheet real quick. Cash, I think that's it. And I just like to write over there what quarter we're in. And on the front page of the filing, you'll see the shares outstanding. Oops. 107, 525, 925, you multiply these two. I think they have a little bit of debt. 51. 752 and 4466 due to Roivant, which is sort of the parent company, not exactly the parent company. And there's some beginning of a model here, so we can do that as well. So there's no revenue, therefore no costs of goods. But there is R&D expense, which makes sense. Their clinical trials expensive, and there's SG&A expense. So they're losing, at least last quarter, they lost around $60 million. All right, any interest income? Yes, a little bit. Oh, they have interest expense actually. So 1874 plus 357. So that debt, of course, comes with some expense. A little bit of tax expense there too. All right, now we're set. Let's do the same thing for last quarter. R&D 25,276. SG&A 12,631. No interest income. A little bit of taxes there, and we're good to go. So I'm just going to eyeball the cash flow statement, and you can see cash flow is a little better than net income in both periods. See, sometimes you get more information than you usually get. Combination of donepezil and a peripheral muscarinic antagonist. And then what's 104 is rivastigmine plus a muscarinic antagonist. Rivastigmine plus muscarinic antagonist. Okay. And they're testing them for AD and LDD. So we didn't update the front page last time for a few of these, but we did that now. I'm just going to glance through this relatively quickly. They did a loan with Hercules. That's where the debt comes from. Family members. Second product candidate is an inverse agonist for 5-HT2A inverse agonist. So, I don't know if you noticed that while scrolling, but I certainly did. And again, they describe the phase 2 versus phase 3 a little bit differently here, which is kind of interesting. $12.5% royalty. Arena Pharmaceuticals. That's where they got that neotanserin from. So write that down. risk factors. All right, so we kind of got through this 10Q filing again a little bit quickly, but I think that's fine. Most of our analysis should be actually on the medical clinical side. So let's go ahead and open up PubMed. And what we're going to do is, since we know that this used to be called GSK 72457, I actually think we should do the search for that. And maybe that'll get some more results. And we got 11 results here. So let's see if we just search for that number sequence. I wonder if there's more or less results. It's kind of asking us to look for something else. So maybe if I do this, that'll work. Okay. So we've got 16 results. And what I like to do in a situation like this is, it's a little silly, but let's get all of these in text, and I'm actually going to make a tab called literature. I'm just going to paste them real quick. And so as we paste them, we can read them, and we can get each paper and start reading them. But it's fun is to kind of look from the first paper and go backwards. So 5-HT 6 receptor antagonist as novel cognitive enhancing agents for AD. This is a 2008 paper. The other thing we should do is look at GSK's patents. So I'll do that in a second. Here's Sertindol. Sertindol. I wonder what that is. Sertindol. Just looks like a classic atypical with the D2 antagonism. Notice the papers mention it. Looks like it's pretty potent at 5-HT 6. In fact, it's more potent at 5-HT 6 than most of the other receptors. Although it's got D2 and it's got 2A, which are the classic kind of atypical antipsychotic stuff. Alright, so they have more Sertindol papers. A little strange. And now finally you've got this Maher-Edwards study. So this is going to be really important. Let's read the Maher-Edwards study, number 13. Any clinical trial publication is going to be crucial. And this is the 357 patient study. So this is a brand new phase 2 study basically, which we did not look at before. And let's take a look at that. Need that PDF though. Where's that PDF though? Purchase PDF. I am so cheap, and I believe information should be free. So I am going to quickly see if this is on my favorite information freedom website. This randomized, double-blind, placebo-controlled study investigated the efficacy and tolerability of 5-HT 6 receptor antagonist SB 742457. Let's see. Published in Pulse Research. Maher-Edwards et al. 2010. Alright. Come on, Sam. So there was a statistically significant pretty close in all these studies. It's kind of interesting, right? You see there's some efficacy here. Still can't get the PDF. So what we'll do is we'll buy it. That's probably the easiest thing to do. But there's some notes here, nevertheless. So the mean treatment difference from placebo to week 24. Let's look at they did 5, 15 mg, and 35 mg. That's pretty important there. As a 24-week study, co-primary endpoint CIBC and ADAS-Cog. P-value was 0.135. And what's kind of interesting is if you look at this study, you got roughly a 1.6, and this study you got a 1.3, and here you got this really bizarre kind of result of 0.7, positive 0.7. So you got two studies in a row that kind of give you a similar result, and then one study that's kind of out of left field. And that's somewhat interesting. And on the CIBC, it was a 0.6 benefit. So that's somewhat interesting. So let's keep going here. This is a so-called review paper. Review papers are a little less interesting than clinical trial papers, right? Well, here's another Maher-Edwards paper, published a few years later. Let's take a look at that. Maher-Edwards, a randomized placebo-controlled study. All right. 198 patients. You could just write the paper, I don't know if the right published in. Geriatric, psychiatry, Maher-Edwards, all 2011. And you know, we should call Dr. Maher-Edwards as well. See what he or she thinks. Let's look at the design of the study. Okay. 35 mg placebo versus 35 mg versus Aricept. Pretty interesting and valuable study schema. Let's see, CIBC and ADAS-Cog. Alright, so the ADAS-Cog was negative 0.4 and negative 1.2. So you can see that donepezil did quite a bit better than the drug, than interberdine, but both were better than placebo. They don't give p-values here. But you have a confidence interval. And the confidence interval includes the the upper bound of treatment, negative treatment effect. Okay, and they have a MCT number here. 003-48192. Okay. Let's keep going. CNS effects, the interaction of risperidone and 457. This is called a DDI drug-drug interaction trial, which is not too interesting. This looks like another review article. And this is a preclinical rat study. This is an in vivo study of LUAE60157, which, from my experience in pharmaceuticals, that is a Lundbeck drug, and we knew that Lundbeck was competing with this product. So this is a 5-HT6 antagonist as well. This, I think, was their arch rival, if I'm not mistaken. Let's see if we can just pop this in here. Ah, yes, iloperidine. Idalopyridine. Idalopyridine. We should make a separate page for idalopyridine, because if one drug works one way, if two drugs have the same mechanism of action, they should theoretically, not always, but theoretically they should have the same results. And if they have different results, there should be some scientific reason why we can explain those different results. Idalopyridine, not pyridine. Idalopyridine. Idalopyridine. Here we go. Now let's put it in the intepridine. They have the same suffix, that's how drug naming works. Idalopyridine. Idalapyridine is another way to say it. Idalapyridine. Okay, so let's type in idalapyridine, and it used to be known, let's drop that down, as LUAE 58054. 58054. We search just for idalopyridine, idalopyridine. This is what we get, a bunch of animal studies, and we should make a similar list. Excuse me. And here's the latter study. This was published in Lancet Neurology. Phase 2B. Latter. N equals 278. Alzheimer's patients, week 24, ADAS-Cog went up in placebo and down in iloperidine for a 2-point difference, p-value less than 0.01. Very nice. So let's see, what's the difference there? 2.16. Placebo subtracted benefit in ADAS-Cog, p-value 0.004. Very, very, very robust result. And interestingly, they did better in donepezil treated, so this is maybe like a background of they're all on donepezil, maybe. And let's see if we look at intepridine. These patients where the study wasn't working, they were not on donepezil, and maybe they were in these studies, so that could be the reason why it doesn't seem to work here, but it does seem to work here, and even here. So you got 4 studies, and 3 of them seem to work, and 1 of them didn't seem to work, although I'm using the word work kind of liberally. And for alloparidine, this was NCT 0101, 9421. And we should get structures here as well, and maybe see if we can get a 5-HT6 model. It's a little hard to model GPCRs. Therapeutic potential against obesity. And so the study's failed, as we know. Let's see if the Lundbeck folks put out those results or not. Maybe we search for 58054 instead. No study results posted. This was the Starbright study. Phase 3 flop. Starshine. Iloperidine showed a weak efficacy profile as neither of the 2 doses used in the study met the primary endpoint when added to donepezil. In addition, the secondary did not separate either. Safe and well tolerated. See if we can find not just the press release, but maybe even the presentation or something. Doesn't look like it. All 3 phase 3s failed. Although I'm not sure. Let's see. so the reason this is important is, no two drugs are alike, but if these guys had a positive phase 2b, but then they had 3 phase 3s that all failed, it's hard to imagine that interbrodine would have a different, more successful fate. These are more animal studies and in vitro studies. And this is the 5-HT6 in vivo study. I actually like studies like this. So let's look at study 7 for interbrodine. Iloperidine, I should say. Oh, no, interbrodine. There we go. Study 7. So this is a receptor binding study in essence. And basically what you do in a study like this is you try to figure out how potent your medicine is. Let's take a look. Connection refused my butt. So sulfonamide. Let's copy this. This is iloperidine structure. Learn a little bit about the receptor. Exclusively expressed in the CNS. Let's look at the abstract. So let's also get this down. Okay, got that all down. So this is 8,4-methylpiperazine. That's this guy. This is a piperazine. 1,3-phenylsulfonyl-quinoline. This is the quinoline. This is the phenyl. This is the sulfonyl. So this is pretty simple to pump in and piperazine. And so we got a 0.2 nanomolar affinity, which is pretty interesting. That's very, very potent. Usually you can't get less than 1 nanomolar, so really, really impressive. And good selectivity, but not, it doesn't not have an effect on 5-HT2A. So pretty potent at that receptor as well. To nanomolar Ki. This is 60157. So this is this is 60157, not 58054. So hold on a second. So this is a so-called tracer compound. So you do use this to study the binding of other compounds. Did a lot of work with syrup before. It's a good organization that does this kind of work. So we were able to, here we go, determine the ED50 and KI of these drugs, so including 457. So we got here is that 054 is 0.6 nanomolar, and 457 is 0.15 nanomolar, so they're very, very, very similar. See that 457 or intepridine is about 3 times more potent than idalapridine, but that doesn't, in the world of pharmacology, that's basically the same. You're really looking for orders of magnitudes of difference. Okay, so that's sort of the purpose of this study, is to show the affinity. And you can see that the atypicals don't have too much affinity for 5-HT6 other than a handful of them, including sertindol, which folks have mentioned. You have the radiography, which shows the distribution in different parts of the brain. So this is, as I said, a tracer molecule. Here you have these, what do they call these? Schneider, I forget what they call these, shield curves. Schneider. All right, so this is useful. It's very useful to know what, needless to say, what the affinity is. So the inhibitory concentration is less than a nanomolar. This is a very, very, very potent medicine. One of the things you can also calculate, let's say for aliperidine, is the log P. So you always need a log P. Let's go to PubChem, which is its own thing, and let's see if they have intepridine here. Yeah, there she is. Yeah, this is it. Intepridine, and it's 353 molecular weight. Which is small enough to get into the blood-brain barrier. Let's get that structure. It's also, this is fascinating, huh? Wait a second. This looks familiar. What the heck? Come on. Well, it's not totally uncommon for... What the heck? No way. No way. Holy moly. There's no way this is right. This is a bigger finding than the Clinton emails. We all know Hillary Clinton's a crook, so that's not really much of a finding, is it? I am stunned. I am flummoxed. Alright, the log P is 2.5. And let's do the rest of Lipinski here. 1 hydrogen bond donor, 5 hydrogen bond acceptors. 3 rotatable bonds. Okay. This plot has thickened, friends. This plot has thickened. Alright, I think I copied and pasted the wrong molecule, that's why. So, if you look at, I was about to have a freaking heart attack. Look at this paper. Oh, thank God. That was about to be the craziest finding ever. So if you look at this paper, this is the tracer. This is not. Whew. That was going to be wild. This is the tracer. This is not 58054. This is LUAE 60157. And obviously, for any of you playing along at home, if this drug failed, then this drug is going to fail too. So they basically made a tracer out of, in essence, out of 457, out of intepridine. They designed this tracer molecule, which is the same, with the exception of one methyl group, the same as 457. And they didn't do the phase 3s on this, they did the phase 3s on 58054. Otherwise, we would not have a question as to whether or not intepridine would work. So that was a very scary, very, very scary. So let's move this guy maybe here. Let's put this guy here. Alright, so this is obviously very lipophilic as well, but let's get the statistics. And it's a very, very, very different molecule, needless to say. Let's get the... Okay, so this is a little bigger at 398 molecular weight. 2 hydrogen bond donors. 7 hydrogen bond acceptors. 9 rotatable bonds. Much more than the 3 that we see with intepridine. We've got a log P of 5, which is enormous relative to intepridine. Was that 100 times the brain trafficking, basically, or at least the partition coefficient? Some people like to look at topological surface area. That matters too much. Let's take a look here. This is not the right molecule. There we go. 2,6 fluoro. This is the 2. No, this is the 6 fluoro. This is the 1 indol. Here's the ethyl. Here's the amine. Here's the benzyl. Here's the tetrafluoropropoxy benzyl amine. But hopefully that you can see that. 2233. This is the 1. So 2233. Very flexible molecule compared to intepridine, which is pretty rigid. Okay, so that was I was about to run out and start shorting the stock, even though it's midnight. But that's why you got to double check stuff. This is not the Lundbeck compound. This is the Lundbeck compound. Very, very, very important. All right, so we have a little bit more information. Again, this is still very concerning, and the fact that the affinities are almost exactly the same is also very, very concerning. So.